The treatment of tibiotarsic sprain can start during the acute phase by using the capacitive mode at medium intensity. To obtain the best results, the treatment should start from the retropopliteal lymphatic stations up to the triceps surae. This phase aims at releasing proximal resistance in order to favor the drainage of the distal edema. The subacute phase can be treated in the same way. Then treatment can continue in resistive mode on the trigger points of the gastrocnemius and the soleus muscles. Indeed, the resistive handpiece can obtain an excellent decontracturing action in the trigger points. In order to reabsorb the ankle edema, the treatment can go on in the capacitive mode, which should be used at low intensity in the area of the perilesional edema. The recovery of mobility is obtained in the supine position, placing the electrode on the sole of the foot and the metal plate under the patient's gastrocnemius. At the beginning, slight mobilization should be carried out, followed by a more energetic mobilization in the prone position, for example, by using the resistive mode at medium or medium-high intensity. The treatment of the patellar chondropathy with diathermy can start from the quadriceps muscle. Indeed, the quadriceps is stimulated when using the capacitive mode at medium-high intensity, thus giving an effective massage action in the interested area. The treatment can continue in lateral recumbent position also when the pathology includes hip muscles, as for example the gluteus medius and minimus. In order to treat the tensor fascia latae and the fascia latae, we recommend to use electrodes with adequate size depending on the area to treat. Quadriceps trigger points can be treated by using the resistive mode in the supine position, applying an effective decontracturing action on the stiffest areas. With the patient seated, the treatment can continue placing the electrode on the quadriceps or on the kneecap. With the patient in the supine position, a passive assisted mobilization can be carried out, placing the resistive handpiece on the kneecap and the plate under the gluteus. Coxofemoral arthritis can be treated starting from the groin and the anterior thigh muscles to obtain an antalgic and anti-inflammatory action. The position on one side is the best to treat the gluteal region, especially the medius and minimum gluteus, starting with the capacitive mode at medium-high intensity. In order to treat the tensor fascia latae and the fascia latae, we recommend to use electrodes with adequate size depending on the area to treat. To obtain an effective mobilization, the most suitable mode is the resistive mode. The resistive handpiece should be placed on the stiffest and most contracted areas, and the therapist can carry out a good articular mobilization. The therapist places the plate under the patient's abdomen. The best way to treat the low back paravertebral muscles and the erector spinae muscle is using the capacitive mode at medium intensity. We recommend to use electrodes with adequate size depending on the area to treat. At first, the objective is an antalgic and inflammatory effect. Then the treatment can continue in resistive mode in order to treat the trigger points of the quadratus lumborum. The session goes on in resistive mode for the treatment of the lumbar trigger points of the erector spinae and the gluteus. The treatment of the scapulohumeral periarthritis can start from the periscapular and scapular muscle, using the capacitive mode at medium intensity. The treatment of the trigger points can continue using the resistive mode at medium-high intensity. The best position to treat the pectoralis minor muscle is the supine position, by using the resistive mode. The plate is placed under the patient. To treat the deltoid, we suggest the position on one side in the resistive mode. In order to obtain an effective passive-assisted mobilization, we suggest to hold the resistive handpiece on the extra-rotator muscles while the therapist mobilizes the glenohumeral articulation. The prone position is also adequate for the complete recovery of the joint mobility by holding the resistive handpiece on the back side and mobilizing the glenohumeral articulation. For an effective myo-relaxant action in case of cervical pain, the diathermy treatment can be started from the superior trapezius region, the levator scapulae, and all the muscles that can be easily treated in the prone position. In addition, the most relevant trigger points reachable in the prone position can be effectively treated with the resistive handpiece at medium-high intensity. We suggest the lateral recumbent position to treat the cervical pain And we also recommend using a capacitive electrode, since the therapist can obtain a perfect myorelaxant action on the lateral muscles. In the supine position, the diathermy treatment can reach the sternocleidomastoid muscle, the subclavicular and the pectoralis insertion. To obtain the best results, the electrode should be as large as the treated area. In order to obtain an effective mobilization, the resistive mode is the most suitable. We suggest placing the handpiece on the mastoid or on the superior trapezius. To recover functional mobility, the resistive handpiece is placed on the muscles that originate the movement, and the plate is easily placed on the lumbar muscles using the elastic band, while the patient is requested to move. As far as the treatment of epicondylitis is concerned, we suggest beginning in the prone position with the capacitive mode at medium intensity. In this way, the triceps and then the extrinsic extensor muscles, the aconeus muscle and the supinator muscles can be treated. By means of the capacitive mode, many areas can be easily treated in the supine position. For example, the carpal flexor muscles, the pronator teres, and the forearm muscles. The resistive mode can successively be used in association with muscle mobilization, stimulating, for example, the carpal extensor, the supination, the pronation, and the forearm movements. In order to treat the carpal tunnel, we suggest to start from the supine position and to place the plate under the scapula. By using the capacitive handpiece, an effective vascularization action in the pectoralis minor is performed in order to relax the neurovascular subclavian area. The treatment can continue on distal carpal flexors up to the carpus itself by using the capacitive mode. Furthermore, diathermy permits to obtain perfect results by applying different neurodynamic techniques in resistive mode, with sliding and neural tension actions.